For 50 years now, if your house was on fire or somebody was breaking in, most Americans have been able to call 911. Americans now, if they have a mental health crisis or they're considering suicide, can call 988.
There are several reasons behind the increase. First of all, the ease of using the new number, 988. It's easier to remember. And also, because we changed the name, there's less stigma attached to it. The name of the lifeline previously was the National Suicide Prevention Lifeline, and the number was also longer. It was 1-800-273-TALK. That's a handful to remember when you're trying to remember a particular resource. So moving to 988 and making the statement that it's suicide and crisis, I think helped in increasing our utilization by the public. People understand that they can call even if they're not in a suicidal crisis, right? So if they have mental health concerns, they can call as well. The increase in calls is not specifically indicative of more people in need of mental health services or people suffering with a mental health diagnosis. What we have been seeing in the last couple of years is a global pandemic, and we have seen the issues of inequity in communities. We've seen increase in mass violence incidents. The research has shown that the numbers of people who actually go on to develop a diagnosable mental illness doesn't increase even with an increase in traumatic events. We see instead an increase of people who are suffering with some acute stress responses. That means you're having a natural reaction to some stress in your life. And with good social supports, good coping, good self-care, people generally will naturally go back to being able to function the way that they did before the acute incident happened. So do we think that some of these shorter-term acute crises are being addressed by the 988 crisis, Suicide and Crisis Lifeline? Absolutely. We're looking at next stages in developing a pilot for the LGBTQ plus community, and that's happening actually the end of this month, to provide persons under the age of 25 with the option of connecting to a counselor who's specifically trained in the LGBTQ issues that those youth face today. We're also developing the video phone option for deaf or hard of hearing Americans who use American Sign Language. We are looking also to improve our response to contacts that come from the tribal communities to ensure that Native Americans and Alaska Natives have access to culturally competent, trained 988 crisis support. Because we know, as has been our theme around 988, is that when people are connecting with those who they feel understand them, accept how they feel, have some knowledge of their culture, it really helps in them having the type of engagement that can add to a successful intervention.